People ask me because they know who I am. I've been around here for a long time, and they know who I operate, who I work with. Hey, who do I need to see for this? Who do I need to see for that? And we reloaded all of orthopods in the past, what, 5 years?
Yep.
And the guys we have brought in are absolutely top of their class. They are outstanding, and I personally operated with most of them. I haven't operated with him yet, so. I go in and
You were sleeping. You were there. You just were sleeping.
No, I was awake.
Oh, were
He
you?
was
I was
actually
awake.
talking to me during surgery.
I was awake.
Wow.
Yeah, so that doesn't happen often, but I said, people want, why would you do that? A, I got a difficult airway, but the other thing is, I wanted to hear them cut the bone. We cut bones for so many years, and you know, when you cut the bone and it's like butter and it goes, yum, I'm like, and I said, I wanted to hear that, and I said, as sick as that is, but that's from doing so many surgeries. And I just sat there, and, you know, I was wide awake talking with the CRNA, and I said, that's good.
Now, so you might have a different perspective because you're there, but what do people say to you? What are the concerns that you hear, and what are you saying to them?
Well, I mean, people want to know, hey, am I going to get better? You know, what's their success rate? How many infections have they had? How many, you know, bad joints have they had, and all that stuff? And you know, I can tell them, you know, every one of our numbers are either at the highest for good or at the lowest for bad, and we have great outcomes. And we have a great therapy department. And if you look at the whole situation from the time you walk into the hospital, when you go into GSCU, you have your IV started. You have, I mean, there was 4 people. One's shaving my knee, one's doing an intake, one's starting an IV. And within an hour later, I was getting a block, which that block lasted almost 3 days before I had any pain at all. And so, and then they did a spinal before, you know, once I was in there. So we have 3 rooms running for him. It is a very systematic design. He has 3 teams dedicated to him, so while they're finishing up in one room, they can start in the next room. They're setting it up in the 3rd room. So it's a definite process. And everybody I talked to, they said, I have never seen anything like that. And it's just like,